Hi, I'm Dr. Trent. I'm the Director of Medicine and Conservation here at the zoo, but that means that I'm the vet for all the animals that need care. And so today we're going to show you what an annual checkup looks like on one of our animals here at the zoo. So this is Maxine. Maxine is a Flemish giant rabbit. You've probably seen her in some of our other videos. She loves the public eye. But today we're going to have her do her annual checkup. So I'm very particular about how I do things, so I apologize if I look down or away from you, but I'm just doing my normal procedure and I'll just talk out loud to tell you what I'm doing. So the first thing that you think about when doing an exam is I want to listen to the inside of the rabbit because there's very important body parts there. So the heart and the lungs are on the inside and I can listen to those using my stethoscope. So I want to put the pieces in my ear and then set the head of the stethoscope on her chest and I can hear her heart. And then I'll go to her back to listen to her lungs. You want to make sure you do both sides for the lungs and for the heart. Everything sounds great. Okay. And the next thing that we're going to look at is it's important to have a process. So for me, I look at rabbits from front to back and top to bottom. So the first thing that we're going to do is move to the chair because I look at rabbits better when I'm sitting down. Okay, so we'll go ahead and hold her like this, and then so one thing that you want to check on all rabbits is to make sure that they don't have any runny noses because sometimes they don't show symptoms of being sick, but one of the first things that they'll show is having a runny nose. So we'll go ahead and just support her head a little bit and look underneath, and it's nice and dry on her lips and area under her nose. And then the other place you can look is on her dewlap. And so dewlap is a part of a female rabbit where they have this kind of little extra fat fold under their chin. And then you also want to look at the tops of their paws because sometimes if they've got a runny nose, they'll actually wipe their nose with their paws, and so it won't show up on their face, but it shows up on their feet. But hers are nice and dry. We'll also look at her eyes. So we want to look at her eyes on the outside and make sure that the pink part and the edges of the eyelids look okay. But we also want to look at the back of her eyes. And so the back of her eyes, I need a special tool that's called an ophthalmoscope. And so what this does is it shines a bright light and then it has a magnifying glass on the inside, so it makes it so that I can see the back of her eye. So we'll go ahead and I'm going to take my stethoscope off now so it doesn't fall off. And we'll look in the back of her eye. Good, Maxine. Good. Okay, so what you look for on the back is to make sure that all the parts that are supposed to be receiving light are, because that's how we see is to have light go to the back of our eye. We want to make sure that there's nothing that's in the way of that happening. Okay, and then we're going to look at her ears. So we're going front to back, so we'll look at her ears now. And they look like they're nice and dry. We can use something that's called an otoscope, and where you put a little tube down their ear and look inside. We're not going to do that on Maxine today just because sometimes that takes two people to hold her and I don't want to do that with only myself to hold her and look. And so the other thing that you can see on Maxine is she has a little marking in her ear that says AW127. So that little tattoo that she has there is something they get when they are spayed. So lots of you have pets at home if they're spayed or neutered, and so that's a marking that she got when she was spayed so that I know as a doctor that it's not something that I need to do, even if I don't know what happened in her past or if she came from an unknown place. We know those things about Maxine, but a lot of pets don't, and so that's why veterinarians put little tattoos on them so that in case for some reason that animal didn't have a history or we didn't know what had happened in their life before they became a pet, then that way we know that they at least have been spayed or neutered. Okay, so we've done the nose, eyes, ears. Now we're gonna feel for something called lymph nodes. So I'm gonna feel under her chin and in her armpits and on her belly and behind her knees. And so those are spots where these little lymph nodes are, and all they are is little small balls of an organ, and if you have an infection, they'll get bigger. And so we can feel and make sure that all of them feel about the same size and the same shape, and make sure that everything looks good there. And I'm also feeling her belly, so I'm feeling to make sure that she's got lots of food in her stomach, and she does. And then I can feel her kidneys, and so that's the part of your body that turns your blood into urine, into pee, and make sure that those feel normal. And then we'll feel and make sure that her bladder is full. And so everything feels great on Maxine. So we've seen and we want to look at her fur and make sure that her fur looks good. You can see how fluffy it is and how she's losing lots of it right now because it's very hot outside today. So you got lots of fur that's coming off, but that's good, that's normal. Then we want to blow down in her fur, and you can actually, if we zoom in here, you can actually see rings. And so even though she looks like she's kind of black and white, when I blow on her fur, you'll see rings of color on where it's white underneath and dark on the outside. And that's because rabbits have a couple layers of fur, and they have something that's called a wool layer and a guard hair layer. And that wool hair layer keeps them warm, and the guard hair layer is kind of like a waterproofing outer layer. So I'll give a nice blow here. And hopefully you can see those rings of color on there, okay? So she's got normal rings of color. Now the next thing that we have to do, so we talked about seeing the top of the rabbit, now we have to see the bottom side of the rabbit. And to do that, we have to lift Maxine up like this, and we're gonna set her on her tush, okay? And so this way we can check and make sure that all of her joints work well. So you can see how I can extend her legs and make sure that all of her joints are working all well, and I can feel them and make sure that they're all very comfortable, right? And then we're also gonna feel her belly and make sure it's soft and she doesn't have any hard spots on her tummy. We can check and make sure her tail is clean and look at her fluffy little cotton tail. It's very cute, right? And it's nice and clean. And then we wanna make sure that we look at her teeth as well. So rabbits have teeth that grow all through their life. So it's really important that they have hard things to chew on and to eat. So one of those things is hay. And then they also can eat all sorts of vegetables and other things. But what we're gonna do is I'm gonna change hands here so I can hold her a little different. But I'm gonna lift her cheeks up from the side really gently just so I can see her front teeth and make sure that those are straight. It's okay, sweetie. And you can see that she's got nice straight front teeth that come down to a good point, and that her gums are pink, and that her whole mouth looks good, her tongue looks normal. And so that's one of the ways that we look in their mouth. Now, if I have two people, and if we suspect that she has a problem, we can actually look at the teeth in the back. So even though they only have those 6 teeth in the front, so they've got the 2 on the top and then the 2 on the bottom, and then those 2 on the top, they actually have another 2 that sit right behind those. They're hidden. Those are called peg teeth. And so they have a little stacked teeth in the front. So they have 6 in the front, but then they've got lots in the back too, and it's important that we look at those. And we can use another special tool called a speculum to see into the back of their mouth. But that is what a rabbit exam looks like. And then some of the other things that we can do for these guys is to collect some blood to make sure that their liver and kidneys and other organs are working well. We also want to make sure that we keep track of their weight, and so we'll take a weight to make sure that her weight stays stable and normal. And then we can also do ultrasounds and x-rays and any other kind of tests that we need to do if we suspect that she might be sick, or if we are planning on doing something later on where we might need something to compare to. That way we know what's normal for her, and so we can do something like an x-ray to see her bones, so we know what's normal for her in case something would ever happen in the future. Then we have something to compare to. So that's what a normal annual exam looks like. Thank you for all your time today. It was really great to get the chance to talk to you, and if you have any questions, please put them in the comments. We're really happy to answer them.